Okay.
So I want to be respectful of your time, but we have a lot of stuff to cover today. So thanks for coming in. And I want to start with calling on John for a commission update. I think you've had some discussions at the commission level since this group met last week.
Yeah, and we did kind of discuss, and Ryan discussed also that these reports look very, very good for like us commissioners when we get an opportunity to look at them ahead of time, or ahead of the schedules and things like that. And he also mentioned about, he was looking forward to the projections for maybe 3 to 5 years down the road. Get, project out that far with the previous data. So I think that we pretty much, as a county commission, have decided that this is definitely a way to go, move forward with this type of. Now, we're not gonna get rid of the ENCODE reports that he pushes out to us also, but this is gonna give us a lot more information on the daily, or not necessarily daily, but workable future, so. Yeah, I think this is a very good way to start moving forward, to get as much of this, and I know you're gonna be on vacation and some of those kind of things, to get it processed and get it as much as we can, information as we can by end of June, first part of July, so that, we can kind of compare what we're doing with these reports compared to what we're getting from Patty. And all the department heads have already gotten, and some of them has already turned in their reports for their projected budget, so. This will give us an opportunity, if we can get, projection. So it's an opportunity to sit down with them too, when we have the meetings, commission meetings, when they're in there for a budget process.
Do you have access to that, the requests at this point, or the projection information, or do you need to work with Patty on?
Well, Jolene told the software support guy that he should give me whatever I ask. So I just need to know when they're done with the month, because I don't want to do reports and find out. They don't
Yeah,
have.
absolutely, but I would assume that within the next few days, Patty will be done processing last month. So. And if you want to check with her, or you want me to check with her, let me know, or.
Okay.
I think she'll be very amendable now that the end is near for her, so.
Well, and we're passing, and there's still election to go, but we've
Yeah.
got a little breathing room between now.
Yeah.
So, and you have a specific list of other information you need from Patty as
I
well.
do. That should be here. She's,
I
You know.
don't believe her.
Okay, well,
I can email it to her.
and we can come back to that in more
Yeah.
detail in your subcommittee report. I don't know if everyone heard Ben share earlier that the commission has approved the charter that we put together, so that is officially approved. And then the other topic that came up at the commission meeting last week was ambulance service, and a specific request for this task force to make a recommendation to the commission on the ambulance. We haven't talked about the ambulance yet. It's not beyond our global review of every department. So we do want to spend a little bit of time today talking about where we're at now and how things are trending and looking. And then how do we want to go about putting together a recommendation? So
So Jeff has put some numbers together, and you got enough of these copies to share?
I think so. Just make sure I've got a copy to speak to it. Let's see, there's those.
This is the same number for. And then.
Big job.
Yeah. And
one more.
I don't.
Okay.
Copy machine right there, so we can make.
John,
Yeah,
I'm
each
hearing.
Okay. Yeah, that one, that.
Give them a minute.
Oh, we got a copy machine right
Yeah.
there. Here we do.
We walk in the front of it.
Okay. Share.
Okay.
Sorry.
Thank you.
Yeah. He shares it. So
Yeah.
Jeff, yep.
See.
One of these.
That's the shape too. So do I think.
Doug, did you get those? Thanks. Got all of these in my.
Sure, how many copies?
So one thing that I want to mention while we're getting this copy that ready to go is previously when previous commissions, and I'm not passing the buck or anything like that on, but they hired a third-party billing company out of Pennsylvania. And there was, I don't know if there wasn't enough eyes on it or what the deal was, but there was kind of a situation where for a couple of years, we weren't getting all of our funding that was billable, done, billed, and sent back to us. And then if it was getting billed, I don't think it was all coming back to us in the way that it should have. So the first year was in 2023. We showed a loss for the ambulance service of about $600,000. And then we decided to bring billing back in-house so that, and we did our own billing, started doing our own billings. We still had 6 months of the process going there. And I think in 24, we ended up losing about $420,000. Now, in 25, every year the number's gone down since we've taken our own billing and collectibles ourselves. When Jeff has come in now, and I've got a lot of faith in him bringing that, I think 25 was $280,000 shortfall for the county. And obviously, we know that the ambulance service is not, it's not an essential service. It's funded totally by the county. We are the only county in the state of South Dakota that fully funds an ambulance service. Other counties assist in funding private ambulance services, but they don't fund the whole thing like we. So Jeff is, I've been kind of on Jeff to get us to where we're either close to breaking even or breaking even. And he's working very hard and diligently on that. And he's got some numbers here to share since he's came on board. That's kind of what, and one of the issues is some of the commissioners are leaning towards and they want to go to an ambulance district, which in my mind is just another tax shift because you're going to need to add a levy to run the ambulance service. So I think if we can get it under control to where it's going to cost us $200,000 as a service provided to the constituents of Yankton County, then I don't think that's too much to ask. We'll see how if we can get there or not. So.
John, before we dive into the numbers, can you answer some questions like systematically of how ambulance service works? Because it's been a minute since I've been on city council. Or
So I'll give you a little background.
so you said statewide, we're the only county that runs the ambulance service. Why is that? What do other counties do?
They have private individuals or the city will run the ambulance service. And then counties help fund it.
Okay.
City of Yankton does not help fund the Yankton County ambulance.
John, I would have, most are are volunteer services.
Yeah.
Okay.
80% of them.
So like,
Volunteer services.
where my other home is at in Lincoln County, I'm in the middle of nowhere for fire districts. So I'm between Harrisburg, Lenox, Canton, or I'm sorry, Lenox, Lenox and Harrisburg. I'm like in the middle. So each one of those has a city volunteer ambulance service.
Yes.
So the county is then providing for those individuals to go and run to cover. And it's kind of whoever gets the call.
Actually, Lincoln County is working a process right now about looking at an ambulance district, which they're gonna levy the taxpayers,
Okay,
and that money is gonna have to go to the city of Lennox or the Lennox ambulance service or the T ambulance service, or however that gets structured.
okay.
And they're working on that right now.
So just like the fire districts.
Yes. Yes.
So is there an advantage in doing it like the fire districts instead of,
I don't see it, but evidently somebody must, if we're the only county that operates our own.
The biggest problem we have that we're trying to address is we're not budgeting our capital expenses. I've got $2 million of equipment in the garage, you know, between my ambulances, my monitors and all the things that we carry.
Yeah.
And we don't have a plan to replace them, and all of those things have to be replaced every 5 to 7 years.
sure,
So, you know, from my perspective, I don't care where we go with setting everything up to cover that, but we have to plan for it. It's just irresponsible. So,
The advantage I would see, John, is that when you have the ambulance district, you're not pulling money away from the very limited revenue we have to fund the general fund.
I get that, and I understand that also. But in my mind, it's still another tax shift.
But we have that crunch we're trying to fill, and that would be a way to do it. Generate additional income, so we're not funneling money to the ambulance that we might need for something else.
so right now, we're not directly assessing the taxpayers with an ambulance bill. It's just coming out of the general county budget.
Yes.
so there are private companies, so patient care in Sioux Falls is private, Can is hospital-based service from Sanford, so there's a private. Sure, you know, so.
Yeah, there's contract, yeah, they
It's
expect
better,
it.
so, yeah.
Have we explored contracting?
It really does service locally close enough, that would be good. You see,
You're gonna have to prove your revenue to the contract service to make it worth their while to be here, and right now, our revenue is not going above and beyond our expenses. So it's gonna be really hard to get a contract service to come in here with the loss of revenue.
Does anyone remember how many years ago they did the ambulance? They had a task force within Yankton that looked at that, so it was 2020 maybe?
There was a task force a long time ago. that looked at it.
Yeah,
We
sometimes,
just did one in 23.
okay,
Hired a firm to come in, a consulting firm, and in my mind, that was pretty much a waste of money because, you know, they told us that this facility, we needed to build a new building for the ambulance service. And,
But we do, but that's near that.
no, I know, but
A lot better than what we used to have, Paul.
I know.
In the corner of City Hall.
so that was pretty much a waste of our money, I don't, probably their time. But I don't know. If there is a right answer, that's kind of what I guess we're kind of,
and is it our state doing a task force or
the
is?
state is doing a task force, in fact, the 17th is their first meeting. It's a summer study.
They're doing another summer study, they've done several, this is just, that's their way of kicking the can down the road to not be addressed.
So if the emergency medical services were to become an essential service like the fire department is, like the police department is, like the sheriff's department is, we could go to the city of Yankton and say, hey, we're not gonna service you unless you kick in some funds. And that's what happened in Davison County. The city of Mitchell decided that they were not gonna service outside of the city limits of Mitchell or Hanson County, which they basically forced Hanson County, Davison County into an ambulance district. But what happened there is the ambulance district levied and the city of Mitchell and the counties agreed that they would counties would pay them $600,000 a year. So therefore, that's what the levy is for the constituents of Hanson County and Davidson County outside of the city limits.
Challenge here, doing the reverse of that is the city of Yankton residents are already county residents and are contributing for themselves. That's what I hear. The citizens of
There's
Yankton.
a lot of things to consider with that. There's a bigger impact to our operation with the city too. There's homeless shelters and psych wards and things that generate a lot more volume, but that's a whole conversation.
I'm sorry, do you want to introduce yourself?
Yeah.
Everybody's mentioned.
Jeff Brown, ambulance administrator. I came into this position in December. So my background is I was a flight paramedic for the past 12 years. I ran a helicopter EMS base in California for 9 years there. And so administrative work is something I've done for quite a while. When I came into the ambulance here, I looked at what we had going on, and there was a lot of inefficiencies. So we've worked hard to correct some of our operational inefficiencies. And I think that kind of reflects in our revenues. If you look at our first.
Advance on Ambulance to 102 Benedict Lane, 32-year-old male.
If you, this is the
With
weekly
left is
county
conscious but not
revenue
able to
brought in.
move. Again, we'll be sending an ambulance.
So the way ambulance billing works is when you perform the service, you send the bill out usually in the next 2 or 3 days. And then once you send that bill out, we don't collect on it for 30 to 60, 90 days, depends on the insurance conditions. So the revenue that we're collecting in the first part of the year is stuff that we performed in November. So that gives you an idea of that.
So these are dollars collected, not
Dollars collected, this is dollars collected. For the first 7 weeks, we averaged $17,925 a week in revenue. What we changed is we changed our schedule, so we had more overnight time on the ambulance available so that we could do transfers out of the hospital. We were turning a lot of transfers down. Our money comes from transfers. If we don't make money, we don't have more calls. If we make money, just like a trucking service, it's billing miles. So the more miles we can collect, the better we do. So we've been making a lot more transfers. They're up 52% from what we were doing before. So with that, we also saw some problems with our billing that we weren't coding things properly. We didn't have a CQI program, which is a quality improvement program in place. They hadn't QI'd a chart in 5 years. So we've been going back and looking at all of our charts, and we're noticing things, just documentation issues with the crews. They need to clean up some documentation because insurance companies won't pay if your documentation is incorrect. So we've gotten all those problems resolved. And for the past 13 weeks, we've trended at almost 25,000 a week. So it's almost $7,000 a week we've increased our revenue. So our projection for this year is close to 1.2 million. And if it wasn't for that first 7 weeks, we'd be right around 1.3.
Well, the first 7 weeks is really the end of 2025.
Exactly. And so it doesn't really count, but just the way that it's going to end in the year. So we think we've got ourselves to a place with where our schedule is, where we're at, and how we fixed our billing, that we're finally going to see pretty close to 1.3 million a year. And when we first started this process, our first quarter commission meeting, we spoke to this, but we couldn't really give any definitive answer because we haven't trended enough. We didn't have enough data to really show that what our trend is going to be. And so I feel pretty confident having 13 weeks of this in a row that we're on track, and that's what we do.
Have you broken out your payer source?
I'm sorry.
Have you broken out the percentage of your payer source?
Yeah, we're 50% CMS for Medicaid, Medicare, and then the rest of it's commercial insurance, and then a small percentage of it is health. So, and we are on track with pretty much every other, area in the state. It's pretty consistent across the state.
And then what are you getting for your billing and for your charges? And then what are you getting? What percentage?
About 50%.
50% of your charges.
Depending on the payer mix, yeah. So we do a transfer. We'll charge $1,800 to $2,000 for the transfer. Sometimes more depending on the mileage, and we'll collect about $1,000 for each transfer.
So this is just the cash you receive.
This is just
It's not
received
your
cash.
billed
Yeah.
cash.
So we can go through the rest of the budget on the other sheet, but this is just received cash. I just kind of wanted to highlight what we've been working on and where we think we're going to see for them.
Although where you're trending and what do you expect? If that was a subsidy of $280,000 last year. And projection at this point for where you'd have to go, maybe let's think.
My projection is probably gonna be around $180,000 of cost this year. Give or take.
Picking up a third. of it.
Yeah.
To the operation.
How much you having to write off the bat then? Not talking about the, when you charge 2,000 and pay 50%.
Well, we're not really writing anything off the bad debt. Reason is we used to have a process where anything that we weren't collecting, that would go to collections, we kind of let go when we run it off the bad debt. Now we're sitting on that. under. So all of those bad debts are pending with the property, so I'm not really sure where.
How do you mean somebody would look at first?
They mean anyone's property, so it's not just a property, if it's the property, they could own a vehicle, they could, so anytime something goes through probate. They collect from it, so we're just trying to stay away from the bad debt and write-offs and just push everything into.
So that aside, what percentage would bad debt be if you weren't doing the lien?
Probably around 50.
So when you change,
And that's an estimate, I really don't. Yeah.
when you change your process for billing, do you have designated staff that do the billing and review or does everybody?
Yeah, so we have a billing department and right now it's 2 ladies that work in the front doing billing. And we're gonna be dropping down to 1. We've gotten pretty efficient and there's not enough work for both of them to do and one's retiring and so we go back to not to replace her. I do the quality improvement every day. For all the charting and all that stuff, and I also help with the billing department.
Is the employee part-time or full-time?
And what kind of training or updating do they get over the course of the year for changes in coding and that?
We don't have a process and that's a weakness, so we have to try to do what we can to stay on top of things, but we need to start budgeting to send them to building coding classes. That just hasn't been something we've gotten to yet. Questions in the way?
So you seem pretty familiar with all this. Is there any AI technology that can be leveraged to improve efficiencies and eliminate the need for FTE?
So, and the problem is, the billing is very complicated and if we had a small AI component where that Bruce could just do their narratives and their chart through AI. That cost us a lot of money, so we went back through and saw that it was miscoding our billing.
Right, means that basically that would fix the problem.
It ended up causing a lot more work than we would have done if we just. We're just not there yet.
Technology just doesn't.
Maybe someday, but not yet.
Are you providing any services you're not getting reimbursement for?
Yes, so, there's a small percentage of transfers that we do that we don't get reimbursed for. It's really difficult to triage those. So what inevitably happens, in my experience doing this for the past 12 years in administration, is if you go to a hospital and say, we're only taking people that are paying, they start finding other ways to send their patients because you're now turning down a lot of patients and they'd rather not deal with it. So it usually doesn't come from an administrator perspective from the hospital, it usually comes from the departments. The departments will find the easiest path of least resistance, and that makes sure. So if you start telling them, no, we're not going on this mission, that patient, they're gonna say, well, this ambulance or this flight company can take that call, and they don't turn this down, so just start calling. Now we've lost more revenue than from just turning down this small percentage. So you have to be really careful.
And clinically, there could be delays.
Yeah, exactly. Exactly. It's very complicated. You don't want to have a detrimental deterioration of a patient because you're turning something down just because they don't have insurance. So you have to be careful.
Do you get any calls for coming in homes for transfers or, it's a big issue out there. Somebody falls off the toilet, bad example, but, and they're not injured.
It's a great example. We bill for that, actually.
You are.
There are very few services that we do with bill. We go to fire standbys and help them in case a firefighter gets hurt. We don't bill for that. I don't know. That's a great question.
I mean, if you're there providing the service,
Yeah.
I mean, I'm sorry, you know,
Don't
if
disagree.
you want to have that, you need to pony up unless there's some
Yeah.
statutory reason that you can't.
Yeah, I
Well,
don't.
it's probably because we have a volunteer fire department too. So,
That's one piece of it, one of the volunteering, I think.
But one thing too, you know, we pay for these staff members to be here 24/7. And so we also don't let that service hinder other operations. So if we're on a fire standby and a 911 call comes out, sorry guys, we've got to run this 911. So we're really not losing much to go sit and watch a fire. And if somebody gets hurt, we are charging to their.
How many other cities in Yankton County have a volunteer ambulance service?
In Yankton County, we don't pay.
I read it.
They're not in county.
Yeah. they're
They
right.
don't-
Yeah, and their ambulance is not operational. So.
So we're the only ambulance service for the whole county.
Yeah. So our problem is, we're pushing to run more transfers. Helps the hospital, helps the community, helps our revenue. But when we do that,
Yes.
now we leave ourselves
Vulnerable.
vulnerable. And so it's a real balancing act, right? To make sure that you're keeping services available. So right now, there's a grant out through the rural healthcare transformation that we're trying to get. One of the pieces of that grant is we're trying to get that grant to pay for a transfer card. And so that would pay for staffing, that would pay for equipment to make it a critical care transport. So there's 3 levels of service. You have a BLS, which is a basic EMT service. Then you have an ALS, which is a paramedical service, a little higher than the Then the critical care are the really sick patients that are on ventilators. We don't do critical care right now. So we're trying to build that program through the grants, and that opens up other opportunity for us to go to the hospital and say, hey, instead of calling $60,000 helicopter, why don't you send them $3,000 ambulance? So that we have the same exact service you have. So there's a lot of opportunity at the hospital for us to pick up some of that business.
But that requires.
But that requires capital, and so what we're trying to do that through is this grant. It's a 5-year grant, so if we get awarded, it'll show a proof of concept for us to be able to put that service in place, and then we can see how viable, what revenue. That ambulance for transfers, and if it is viable, we can keep that going, you know, beyond the grant.
So.
What- No, but with those grants, the sustainability is there, and if you aren't meeting the criteria, the sustainability, then
Yeah.
the state, you don't. So that's, if you say you're gonna do that, how are you gonna sustain that? You said, we'll see if that supports it, but if you don't meet those metrics, then you're out and the state has to give that money back.
If we have enough volume out of our local hospital to sustain it as is, without picking up additional, you know, calls for the critical care, and it relieves our liability for the community. So now I have 2 ambulances that are in the bay available for 911 calls instead of 1 ambulance on the transfer in Sioux Falls, while the other one covers the entire county. So the volume's there. We're gonna continue to get all of the revenue that we would always catch up off of this stuff anyway. And if anything, we're gonna gain more. I have $57,000 worth of transfers that we turned down because we didn't have staff. So if we only have 1 unit, we can't send both, you know, that unit on a transfer. And so we're tracking all of those turn downs to see what we're missing, and we're looking at, you know, ways to catch that. And this is how we've figured out.
So how many, like, on an overnight, how many people do you have on staff?
It varies. So we used to only have 3 on staff overnight. So 1 ambulance staff, there'd be an additional person that if somebody would call in from, if we got an extra call, somebody would have to come from home, staff the ambulance. The problem with that is if somebody has a life-threatening emergency, now we're delaying that person getting the care that they need because somebody's got to come from home. So what we did is we redid our schedule so that we have, I think the coverage is probably somewhere around 50-60% more coverage at night. So we stacked our schedule, so there's 2 ambulances on at night, more days a week than there were before. It's the same staffing, but now we're actually picking up transfers on those nights that we did before. That's why that. So we do need to look at adding staff at some point on all of those other days so that we can actually have the whole. It's pretty, some of the pickings at night after 10 o'clock.
So if you're doing a transfer, the hospital, do transfers only happen during the day or they happen at night?
They're 24 hours.
Okay,
Most transfers happen during the afternoon.
Yeah.
80% of them come during the afternoon, but they do happen all night long. And 50% of the time during the week, we're turning them down because we only have 3 staff.
so if you're doing a transfer, then what's your coverage? You have enough for one ambulance
One ambulance covers
for the whole county?
for the whole county, and but if we don't do it, we don't have any revenue. And then the
Right, no,
other thing
I-
is, some of the transfers are critical. So these patients are treated essentially like a 911 call because they're having a heart attack or having a stroke.
Right,
And they
right.
can't handle that service here, so it's no different.
They don't need the chopper, but they can, yeah.
So how often does it happen where, to Tom's point, they go, oh, we only have one and we have now 2 calls?
It's not super frequent, and I would say this is a little bit anecdotal, but I'd say it happens once or twice a week. And we have a mutual aid, so we have Clay County can come in and run. Our crew are really good about triaging things. So if they're going to, drunk guy at age, I'm sorry, I just had a breathing fart. But if they're going to a drunk somewhere at the jail or somewhere else, then they're gonna say, hey, we're gonna put that off and we're gonna run this cardiac arrest. That's gonna have the hold, so they'll triage what they can. And then they do call in, and our crew are pretty good about staffing up from home. So usually it takes about 5 or 10 minutes to get people to come in and run another ambulance. But that level of commitment from people is, trending down. People, the economy's worse, people are having to spend more money on things, they don't have as much time to dedicate volunteering to things. And you're in just a cultural trend of generations, you're just not seeing as many people step up to that kind of stuff. So
When they're on call, are they paid at all for being on standby or just when
they used to have an on-call service. We shifted that. So they get paid double time to come in and run a call. So they're not paid to sit at home anymore, they
Right.
just get paid down. Okay, so there's an incentive to come in.
Sure.
For them. But our budget doesn't really allow.
Sorry for all the questions. The last one, what's the furthest response time you have in the county, given we have the whole cut? So what's the expected help of 20 minutes?
Say 25 minutes probably, so. But the volume on the other end, you can't put an ambulance at the other corner of the county because you should not want to.
No, I-
85% of our calls.
Discussion on you for time. Out to
Sure.
about 27 minutes left. John, when does the commission need a recommendation from us?
For the ambulance, end of the year.
Yes.
I'm not in any hurry for it.
Okay.
So end of the calendar year or end of the fiscal year?
Same.
That is our fiscal.
Yeah.
Oh, we're counting.
That's what you got.
I mean, if we could get a recommendation in October, November, but
Did you guys want to speak to the budget projections?
Yeah.
Yeah, okay. So when I came on in December, we had our 2025 budget, you guys probably know was. But I've given the commission a budget overage report. And we were actually over $85,000 on our budget. And then I gave. We used a different line item in our supply budget to offset that, and then the county had to fund us, I think it was $38,000 that we ended up having added to our budget to be whole. So that $85,000 that we were over did not include an administrative budget, which is $110,000. So there was $20,000 paid to that administrator. So we had $90,000 that we never paid out to an administrator that year on top of being over $85,000. So most of those expenses were errors in the budget. They did not have, there were raises that were put into place. They hired an extra staff member, so there's a lot of factors to that. I wasn't here, not my budget, but it is affecting this year's budget. There are things in that budget with the wage increases, full-time employee insurance costs, just things that we cannot fix with the way that budget, because the budget I'm working on right now was already set, obviously, the year before, and none of those things were accounted for.
based on what you're telling us, how much do you expect your budget to go over this year?
We've got it down to about $30,000. So, it's a lot better than it was. And there's a potential with our building lady that's out right now, that's retiring, that we might even recoup that completely, be zero, but I can't really count on that. One of my other, the main biller is that surgery underneath, and she's out. So we're having to kind of postpone the retirement of our other employee. We're robbing Peter if they fall. It's, so I don't want to say that, you know, I can't really count on that salary being gone by the end of the year right now, so I would say we're probably.
I've been monitoring all the department budgets each month this year, and I noticed yours is over in terms of percentage of salary.
Mhm.
Will that not filling that second bookkeeper position level that out?
That's what I was talking about. We're hoping that that is going to be the case, but I don't know if my employee that is out on leave is going to come back or when they're going to come back, you know, so I have to make sure that would be conservative with that.
Just on part where you say, maybe you get back to zero. That's for variance to budget. You're still looking at a $185,000
Yes.
projected.
We're making more money,
deficit, right?
but my budget is looking
Yeah.
over because of the stuff that happened with our 2000. Yeah.
So we've got some probably future conversations to have about what our options. We want you to be a part of those discussions. Continue to work on the operational improvements that you're doing when other options. We talked about the ambulance district, city of Yankton. Avera has come up previously in discussions. I don't know that necessarily merger or doing something with other services around us is really an option because of the distance issues. You already have mutual aid agreements, so not sure anybody else is gonna want to join us until they see a financial fix, probably. So I'm not sure that's fix for us, but I'd like some input and some discussion from this group about how do we want to go about this? Do we want this just to be another subcommittee to do the deeper dive? Is this part of, I don't know if it's a peer county, if there aren't any other counties that do this, as we talked about. So we want to be involved in doing the deeper dive with this?
I'd recommend that it's a separate committee and volunteer to be.
To be on there.
You got the
Clinical background.
experience, yeah. I just want to throw out an opinion. If we do not pursue an ambulance district, I think we should approach Avera and the city to see if we can get an allocation from each of them to help make up our shortfall. If both of them benefit, and most cities, most communities, the city pays way more than the county. Here, the county's getting all of it.
Work, we'll get some set up. Follow up on that. Okay. All right.
Just
Any
one last
comments?
question. Did the city or did the county ever look at a private coming in for making the offer? Has there, over the course of time? I'm just asking the question.
My understanding is about 5 or 6 years ago, they approached, what's the guy's name in Sioux Falls?
Brandon.
Yeah, they brought come out of Brandon.
Yeah.
Yeah, it was as much or more than current costs, so.
I don't remember. I remember Jay Moser having a hell of a time in Sioux Falls trying to get started, but he is still in existence up there. So something, transferred. And I was just thinking entrepreneurship if somebody's
He's
thinking.
the only ambulance that actually goes out and just transfers out of this area. So that's what we need to do. We need to have some mechanism to go get revenue to fix a revenue issue. And that's just my opinion. If we don't go out and do some business development with our ambulance.
Discussion, and we'll get a subcommittee conversation going. I want to turn over to Catherine for financial reporting. And Catherine, I'm gonna say, let's try to limit this to no more than 10 minutes. Sorry, how much time that we got left.
Well, then I'm just gonna briefly overview this. I have done a monthly report, which is really mirrors the for the office, emergency management, which is really the same amount as the county gets. I've also roughed out a budget for them. But what I wanted, Dan, Terry thinks he's gonna be okay. That was Dan. That ambulance call, Dan Bergen. Sorry.
Oh, I didn't know what you were talking about.
Yeah, I'm sure, sorry. I thought you heard the Benedictine Lane.
No. He's okay.
Terry thinks it's gonna be okay. So county, okay. I've been working with Paul and, Aaron on the Office of Emergency Management. But the county's obligated by state statutes to fund the Office of Emergency Management. And the department is not intended to be self-supporting within the county books. Grant funding may be received 50% for salaries, up to 50% for salaries. Sometimes it's 5%, Paul said. They never really know until kind of at the end of the year, right? Which is after the fact when they budgeted. The other funding that they potentially receive is up to $5,000 for the food clinics. It's called a point of dispensing grant. Then there's the local emergency planning committee. Normally they receive between $1,300 and $1,500. In 26, they may receive up to $3,000. These grants aren't guaranteed. They come from the state, sometimes the federal government. Currently, they're experiencing grants that have been approved by the feds, but not released, and it is not known when or if these funds will ever come from the federal government. The only other grant revenues they're showing are not routine, but like all grants, you apply for them when something comes along that fits the need, such as equipment grants, homeland security grants, FEMA, hazard mitigation. The only other routine revenue that the department has is a very small amount of interest income of $120, and I don't have a clue what that's for. They also had miscellaneous income last year at FY25 of $5,700. And I haven't had time to work with the auditor to find out what that is yet. They occasionally receive funding from insurance companies for pulling vehicles out of water also. Yeah. And then that monthly report that I talked about, it is different than the report, much like the one the county saw, in that they have a revenue section added before they just were receiving the expenses. That really allows Paul to watch for funds that have been applied for and approved. He should be watching to see that those funds have come in for grants. And then we can make sure that they get received and posted appropriately. It also is going to help the city commission or county commission understand how funding for the department budgeting template I'm working on an annual budget. It's kind of a change from what has been done before. Because of budgeting by month and then feeds into another budget. I'll just show it to you. I'll just show it to you. So, if you budget by month and you okay, so that's the way the budget looks. But it feeds off of a monthly budget that goes back and looks at multiple years by month, by account. So it gives you a lot more accurate budget. Paul also mentioned to me that it is not legal to budget for grants, and we do have an $80,000 budget in for a grant from last year. But I don't know if possibly that money was budgeted from an approved grant from a prior year, money that, you know, like the state saying, we'll give you $80,000 to support funding for salaries. If that's the case, then that's fine to budget that because it is an approved grant. Because I would agree, it's not a very good practice to budget for an unapproved grant.
Wasn't that though the FEMA or your salary, the reimbursement for your errands?
Sorry, but we don't, well,
Because that was,
we don't know what we're gonna, right, well, right, so I don't know. I say it again, I don't know if that 80,000 was put in for what was from 25 coming into 26.
It's money, it's definitely received in
But
20.
we don't get the, like, for 26 money won't come until end of September. You know, and then.
but 25, remember, they said that they didn't know, the state didn't get the money from the federal government
Right.
yet.
Yep.
So they didn't know when, until this lawsuit or whatever was taken care of.
Right. And then we ended up getting a
And
check.
we ended up getting that.
Right, but I don't know if
was
that,
budgeted
but what I'm saying that,
to come in.
Very likely, yes.
Patty would know.
Yeah, it's one of my questions that I've got for. So the other thing I wanted to tell you is Office of Emergency Management really faces difficulty in budgeting due to unplanned disasters. The county must realize that there's potential for this and it will always exist. When a disaster does occur, the department's going to experience costs that weren't budgeted, but will need to be borne by the county. But there's a possibility that funding assistance will come in from state or federal sources to cover this or to cover them. Then the other piece of information is just a little update on when the state auditor presented to us a few meetings back. And they mentioned, and that gentleman mentioned that Minnehaha County had a budget OEM much like Yankton County. But what he didn't tell us, because he probably didn't know this, while Minnehaha County has similar staffing and their budget is slightly higher. But Minnehaha County OEM does not assist Sioux Falls. And Sioux Falls doesn't assist OEM. Unless they called in, which rarely probably happens. The city of Sioux Falls covers disasters with their public safety department, which manages the disasters within the city. And OEM, the county, takes care of those outside the city of Sioux Falls. So it really isn't comparable. Yankton County has a lot of waterways that we have problems with. Minnehaha County only has Sioux River, which doesn't really flood that much. Then Yankton County can be called out to assist during severe storms at our campgrounds. Minnehaha doesn't have a situation like that. Yankton also assists the police department drone operations as needed. We doubt Minnehaha County does that for the city of Sioux Falls. Minnehaha Police Department probably has their own drone operations. So for those reasons, I don't think it's comparable to compare those two at all. I just got a list for Patty, which how do you want me to do that? Just contact Patty and
Yeah, I think ask her, want to work with her directly, or if she has somebody on her team that would work with to get the information, because we need to get it to the committee.
okay. That was that 10 minutes?
That was 10 minutes.
I do want to say, I sat in with Catherine and Paul here, and they know what they're doing, and they're very organized and very professional, and I was very impressed.
Oh, yeah, the budget was glorious.
Yeah, no questions, just they have all the answers.
the one thing that kept us in the behind and it's still to this day, and granted, our budgets have gone down a little bit. But was the fact that when we lost our capital outlay for a project capital, we now are trying to go back up with our budget because we have to replace the generator. I mean, they're only good for 15 years or that's what they say. We don't replace them until they blow up. But it's the idea without that, so you're gonna see a little bit of a turnaround in our budgets. To try to make up because we're gonna have to do the maintenance and have to do a little bit more. I mean, and we talked about that, but I mean, that was one thing that really hurt us. So our budgets could go down, probably even a little more. Knowing that we'd have some money stuck away. And if we don't use it, it could just roll over and we start all over the next year.
And that's the same problem with the ambulance service.
Yes,
Also.
yes.
It's a recurring.
And the highway department's got.
Yeah, anybody with a large capital outlay of equipment is gonna have that issue.
But anyway, that's. 2 cents.
We thank you for everybody, your time, efforts.
And Kathy is also doing some peer review work.
Trying to pull in for county, some questions to ask the different counties to see what's comparable, because there is a lot of different services that every county does. So we did pull some additional counties that Paul thought would be comparable in their service, so I'll try to get a hold of those people. Some data together.
Anything else on financial report?
No.
Okay, policy procedure.
I got one thing with finances. I just watched the Lincoln County's meeting from Tuesday of this last week. And they're just starting their budget process now over there. And as far as expenses over revenue, they we were around $3 million over expenses to revenue. They're about $9 million over. So it's not our problem, it's everybody's problem that's going on. And I just seen this morning, I looked up, COLA we were counting on 2.5 for next year's budget. It's 3.9 right now. So that's gonna be a tough one to bite too, so. Hopefully that drops down some by the end of the, by October, so.
Policy procedures, we have met, we're reviewing Minnehaha's, policies and procedures. We want to compare that to the recently approved employee handbook, because we don't have a lot of formal policies that are incorporated into the handbook, so we do think that it's easier to update and modify policies than it is the employee handbook, so we may have some recommendations to shift some of that, but we also want to make certain we don't have two documents addressing the same thing. So we're going to be meeting every other week, ready to bring something back to you. With this task force. So, Brian, I know you got 7 minutes left. You got a lot of data here. You want to get started with it, or do you want to look at?
I think they can get it done in 10 if you can stay 3 minutes long.
Okay.
Yeah, continue to add new items and expand the items that I had presented previously. I had a couple of task force members kind of suggest maybe a 6-county comparison was small. And, we based that on 19 to 31,000 to kind of stay in the same economic ballpark. But I took that input and decided to make it an 11-county comparison. I took 5 counties bigger than Yankton County and the 5 counties smaller. So I made Yankton County the median. So it's an 11-county comparison, and right in the middle of easier, I guess, to see where we fare as far as some of those others. In terms of general fund, we're definitely right there as far as the median county, 14.5 million. At the road and bridge, there's 3 lower than us and 7 higher than our 5.5 million. And as far as cash assigned to the general fund, there's 6 that applied less to the general fund and 4 that applied more. In terms of percentage of the general fund that is taken from cash applied, or again, right there at the median, 5 that have a larger percentage, 5 that have a smaller percentage. Down to the next field, looking at property taxes for general county purposes. I had noted last time that we were the lowest among the 6 counties. Among the 11 counties, we're the 2nd lowest. Hughes County is a few bucks per person cheaper than we are. And I kind of expected that when I expanded the field, that they would be competitive with us. So we're 2nd lowest, which I still think is excellent efficiency. In terms of general fund balance at the start of the year, end of the year, in 2025, we were the second lowest to start the year, second lowest to end the year. And then in terms of general fund shift, as far as the actual,
Can I ask a question on that? Weed County, 290 million,
I
down to 18.8, is there a?
should be at 0.9.
Okay, thanks, that's what I
Last year.
wondered.
Good catch, thank you. So anyway, our actual deficit last year, you can see we started at 5.7 into 5.1, 600,000. There were 4 that actually had a plus, a surplus, and there were 7 like Yankton County that were in negative territory. Some of them quite a bit higher negative territory than we were. This next one is white page. Is the one I've been working on today, and I'm still waiting to hear from Union County in terms of their 2025 numbers. But the point I want to make here is, I want to give credit to the county commission for something that I don't really think has been fully understood. Last year, at the end of last year, county commission reduced our county budget by $3.7 million. I'm talking about the general fund and the road and bridge, those 2 funds. And that's kind of an incredible thing. And you know, a lot of the concerns Jeff Schaefer was making, that really answered a huge chunk of that, as far as, that's what he was asking us to do, is we had to reduce our spending that we had increased during the COVID. And you did that. But I just want to look at something here. I want to look at our 2025 to 2026 budget shift. We were minus 3.7 million. All of the others that I've accumulated so far were plus. Used was only plus 154,000. But what I'm trying to say by that is their budget grew by that much. Their 2026 budget grew from 2025 by 154,000. But the others were like 874,000, 708,000, 855,000, 844,000, 4.8 million, 1.4 million, 5.4 million. Those were all budget increases in those 2 major funds. We went backwards 3.7 million. So I just would like to try to, sometimes I feel like I'm playing whack-a-mole when I hear people say, well, you have a $3.7 million budget. That would have been true if you had not taken that action. It's no longer true. All right, next page. Property tax comparisons. This I found interesting, and we did have these numbers last time. Like I said, I expanded the counts. And the last 2 columns is what I'm looking at. Our owner occupied property taxes last year, the owner occupied portion of it was 4.4 million. If we did pass that half-cent sales tax, that would cover almost all of it. I mean, think about it. Theoretically, you could wipe out owner occupied property tax and replace it with sales tax. So that's something I think should be looked into. This next one is also another item that I want to emphasize is our debt. Our debt is really pretty good shape. Yes, we still list 2.7 million, and that's due to the Napa Junction TIF, but that won't be much longer. And we're in good shape because our facilities, despite what Paul said about this facility, our facilities, but by the way, Paul, most counties don't have to worry about an ambulance facility. That's the unique to Yankton County situation. But we're in very good shape. Safety center, you know, the law enforcement center, the courts, the jail, the government offices, highway shop, all these things are in excellent shape and all paid for. And that is not the case in most other counties. Mama said we were able to do a lot of that. Fortunate, I guess, or whatever you want to call it, that we did a lot of that before construction costs went through the roof. And that's how we were able to pay them off in short order. But just look at the other counties. Blake County just built a $40 million jail. That's debt. Union County is currently planning what will be a major courthouse expansion. Hughes County doesn't have much. They're paying off a jail they built in 2008. They're getting toward the end of that, a few more years. Buell County doesn't have any. Davison County is currently planning a new jail, which is going to change their debt picture significantly. Lawrence County just built a $32 million public safety services building. Cottington County just built a $30 million detention center. And Brookings project is looking at a new jail project. So we're in pretty darn good shape considering that all those major facilities that make up county government, infrastructure are paid for and still in good shape.
Brian, from your perspective, and on that, also, is the issue for us not so much building hanging over us concerns as it is the bridge issues? The two bridges we have left, plus the one that we're building right now.
3 bridges left. Or you have the first one.
I don't think we're in a situation where we need to look at any kind of building projects other than if, if we still want to take a look at the juvenile detention addition, that would be the only building issue that I think we would be looking at. But the roads and bridges is a big issue right now.
Next page is, I just went through some of our major revenue sources. That first column, I'm on the 10 page now. The first column is our 7-figure revenue sources. The next column are some of our 6-figure revenues. And then also the third column is 6-figure revenues, except yes, for us it is, they're all 6-figure revenue streams. This page, and this isn't everything, we have some other revenue, a few of them are mentioned on the next page, but this page alone totals 22 million in 2025 revenue. Now, of course, that all has to be taken with a grain of salt because there's so many unknowns and not everything will repeat at this level. Jail revenue was exceptional last year at 1.75 million. That was way above the norm. This year, it looks to me like we might be about 1.2, but who knows? Maybe we'll get back to the 1.7. Grant revenue, as we mentioned earlier, is going to vary. But bottom line is we do have a lot of revenue sources and it's not quite as dire in terms of that as you might have heard. As far as the wheel tax, again, I guess I repeated this last time. A lot of counties are still at $2 a wheel. We are at the maximum of $5 a wheel. Next page, the blue page. Go over some things like 911 remittances and various other fees. I want to go to this second column. This isn't a peer comparison. This is a tracking of some Yankton County numbers. This is something I really try to explain to people. And during the COVID years, our general fund balances were skewed and were inflated by the COVID dollars. So to say that we have this much less general fund today than we did 2 years ago, it's not an apples to apples comparison. So what I did is I took the 6 years prior to COVID money and I just basically, I have these numbers, but I just basically left them out the years when we had the COVID money. And now this year, we've kind of finally settled back into where we were pre-COVID. You can see that January 31st, our balance was 4.7 million, which was very much in line with the years prior to COVID. March 31st, 4.4 million, very much the same as the years prior to COVID. April 30th, 6.4 million, tracks very close to the years prior to COVID. Obviously, we don't have October and December yet, but I think we're starting to see a pattern that the COVID years are no longer distorting our comparisons. Next item, I had mentioned last time that our auditor achieved 74.1% turnout in the general election in 2024, #1 in our comparison. She was also #1 in last week's primary election at 45.7%, significantly larger than the other counties. One last item is the pink page. This will be fast. I'm being on my time, but I'm not going to talk about the second half of this page. We've already done that. The top half of this page, I did some of the cost per person categories. And as you can see in general government cost per person, that's a lot of the things that go on in the government center, obviously. Only 2 of the 11 counties have a lower cost per person than we do. And I think that's excellent. Now, the public safety costs per person, we're also doing pretty well. 6 of the 11 are higher than that. Health and welfare costs per person, obviously we are the highest. I'm sure some of you can guess why that is. We're the only county that has funds and ambulance service. That's why we're far and away the highest in that category. Property tax as percentage of revenue, we have a lower percentage. It depends on that, 7 or higher. And then finally, indigent defense costs, we're pretty much right in the middle there. Thank you very much. Just wanted to share some of the updates.
Great information. Thank you for pulling that all together. Thanks. For a few minutes over, any other comments or questions? I think for our next meeting, we're gonna try to get some information out ahead of people ahead of time, nothing for, along the agenda, so that we can start to boil it down. Some more. A lot will continue to depend on what's happening with that or something. So it's fun. Good, thank you all. Stay safe tonight, hopefully. See what's gonna roll through. I talked to Jeff about maybe for him to be for ambulance.